All right, so I was about to film this video, but then I realized C1 shearing far away from the camera, you're not going to know what I'm doing. So I wanted to pull the spine out so you could see, first of all, where C1 is. All right, so this is the skull here, head sits here. C1 is the very first vertebra right underneath the skull. It has these very large transverse processes. There's pokey parts. These are what I'm going to be mobilizing. All right, when I'm assessing someone for C1 restriction, just kind of in sitting with moving their head, oftentimes I'm looking at their ability to side bend. As they side bend to one direction, that C1 should have the ability to fold on this side and therefore kind of shear towards the opposite side. When they're not able to do that, I consider that dysfunctional. And typically there's also a very hard end feel, meaning that whenever I spring the ability for that C1 to move, it doesn't want to move. This can result in headaches, can result in neck pain, can result in limited motion, can also result in just tension in the nervous system throughout the body. Okay, so that's my intro. Now, as I go back behind Keely, I am coming up onto that C1 right here. It's very prominent on most people. It lies just forward and either even with or just below the what's called the mastoid process on the side of the skull, right behind the ear. Okay, so I am right on that C1 here, and now I have her head on this foam roll because it is firm. A pillow, as I'm mobilizing, it would basically the head and C1 would just go together. I want to be able to mobilize that C1, that first vertebra on the skull. So I have her head here. I'm feeling C1, and I'm moving her head around just to see what tightens C1 up into my fingers. And actually, if I rotate her head down towards the table a little bit, that's what tightens it up. Okay, so now from here, I could simply mobilize C1 just by having her breathe. All right, and that's what I call, so this is functional manual therapy. This is a functional mobilization here of C1. Good. I could also have her bring her feet up, just her feet up towards the ceiling, like that, and then lower back down. I'm actually going to get in a better position here. Relax your legs back down, Keely. I'm going to sink on that. Okay, now raise up. And that doesn't really do anything for me. Okay, I can also have her bring her arm up towards the ceiling, and we had a positive ooh test there, meaning that that probably was painful. And so go ahead and do that, Keely. Right there, stop right there, and then back down a little, up right there. And then just go in that small range of motion, just like that. So right as she gets to here, I get more tension into my finger. As she goes here, it comes off. Okay, so that tells me that this may be more so possibly related to some tension in her system, that last thing that I was listing, which could also lead to headaches, could lead to pain and limited range of motion. Okay, so a lot of these things kind of go together. Relax your arm down, Keely, and I'm going to further localize. Now it's nodding the chin down a little bit. And I could have her go back into that arm motion, Keely, and right there. All right, and now don't let me, nope, stay right there. Simon did not say. So keep your arm right there. Don't let me nod your chin down. Hold, there you go, good. And that puts more tension into my finger, specifically my thumb, and let it go. And I'm just gonna attempt to nod her down and actually take her into a little bit of, there we go, left rotation. Don't let me rotate your head to the left. Good, or nod it down. Bring your arm up a little more. Now just maintain the head and bring the arm up and down, there and down, good. And now I'm just bringing more tension into my finger to hopefully get that C1 to let go and relax down. So that again, in this case, I'm working on the left side. So I would be hopefully helping her with left side bending so that that C1 can shear towards the right side. Very important for people with headaches, pain up in this area, tension in the nervous system, limited range of motion, all of these things, okay? So there's lots of other treatments that can be done for this area, but specifically this is a very important one that I do in the clinic.